Good evening and welcome to ID 709. My name is Drew Patel.
And I'm David Yu.
We have a breaking news out of Touro College of Pharmacy in the community of Harlem, where there is a resistant strain of Staph aureus known as methicillin-resistant Staph aureus causing a widespread outbreak. Well, David, what is this MRSA thing?
Well, I don't know much either, but what I heard was that this MRSA bacteria is really tough, really resistant. First outbreak was in the early 1960s. And since then, it's been spreading worldwide in both healthcare and community settings. And also I've heard that now the prevalence of MRSA in the ICUs in the US hospitals is now 60%.
Wow, that's really crazy. But you know what? I also heard about one of the sports team contacting MRSA infection a couple of years ago.
Yeah.
Is that true?
Yeah, that's true. Something to do with the Rams, St. Louis. Maybe that's why they stink so bad.
Yeah, maybe that's the reason why they moved out of LA. You never know.
Yeah.
But anyways,
Go Ravens.
back to the outbreak. So what's going on in Harlem? Let's try to figure it out from Mr. Pupo on the street, trying to figure out what's the community of Harlem actually doing to prevent and take measures against this MRSA widespread. Take it away, Mr. Pupo.
We're here on the streets of Harlem conducting an interview to know how much and the awareness of people about MRSA. We'll be conducting an interview, we'll be asking people questions on what they know about bacteremia, what they know about bacterial infection, and how to prevent bacterial infection. Infection called MRSA. Have you ever heard of the word MRSA?
Not really.
Do you know anything about MRSA?
No, not MRSA.
So do you know how to prevent any bacterial infection at all?
Use a condom.
Do you know anything about MRSA?
No. What is MRSA?
It is actually what we call methicillin-resistant Staphylococcus aureus. It's a bacterial infection. If I may ask, do you know what to do to prevent bacterial infection?
Try to keep as clean as possible. Wash your hands.
Okay. Methicillin-resistant Staph aureus. Yeah, I mean it's definitely a problem. We're seeing it increasingly in hospitals, and it's become a real issue, especially pharmacologically dealing with it. I'm not too sure what I could tell people in terms of how to deal with it, because I think it starts with the pharmacists and the doctors prescribing medications.
Good afternoon. We're here at Touro College of Pharmacy to find out what students know about MRSA and how to prevent MRSA. Excuse me, good afternoon.
Hi, how did you get into this building?
We're conducting a research project, and we just wanted to know what the students of Touro College of Pharmacy know about MRSA and how to prevent MRSA.
Oh, okay, sure, but you gotta make it quick. I have to go to my infectious disease class. Well, MRSA is methicillin-resistant Staph aureus, and is a gram-positive Staphylococcus, and there's two types. There's community-acquired and hospital-acquired, and they have different resistance to different antibiotic treatment. And the lines between community and hospital are kind of blurring right now.
Oh, thank you very much. You seem to know so much. How did you know all this?
Well, because I'm a student from Touro Pharmacy, and I have wonderful professors.
As you can see, Touro College of Pharmacy students seem to be well equipped to handle any outbreak of MRSA. Back to you.
Well, thank you, Mr. Pupo. As you can see that Touro College of Pharmacy students actually know much more about MRSA than the community of Harlem. So they need to actually go out and educate the community of Harlem on MRSA.
Right. Now let's go see what the experts have to say about MRSA. Live at Montefiore is our lovely Kathleen Wong.
Hello, this is Kathleen, and I am at Montefiore Medical Center about to interview Dr. Friedman. What kind of infections does it cause?
We see hospital-acquired MRSA in bacteremia, and it causes infections in surgical wounds, catheters, IV lines, and community-acquired is more seen in skin and soft tissue infections, and there'll be abscesses and cellulitis. And it can, though, also cause more severe infections, like necrotizing community-acquired pneumonia, meningitis, septic shock, and bone and joint infections. But lately, there's this problem that there's increasing presence of community-acquired strains of MRSA in the hospital. and it complicates treatment because we don't know if the patient in the hospital has community-acquired strains or hospital-acquired strains.
Oh wow, that was very informative. Can you also tell us how we treat it?
Oh, I don't know. I just asked Dr. Veltri in the pharmacy.
Okay, why don't we go find Dr. Veltri? Hi everyone, I'm Kathleen and I'm back at Montefiore Medical Center in the pharmacy about to interview Dr. Veltri. Hi Dr. Veltri, can you please tell me what the current treatment is for MRSA?
Well, the current treatment depends on the patient's complications, the severity factors, and the risk factors, because MRSA can be related to bacteremia, skin infections, endocarditis, meningitis, and even pneumonia. So based on those things, then we'll go out on how to treat either hospital-acquired or community-acquired.
Okay, how do we treat hospital-acquired?
For hospital-acquired, we treat with vancomycin, 15 to 20 milligrams per kilogram IV, every 8 to 12 hours. We do have to watch out because there's a nephrotoxicity involved with this agent. Other agents used are linezolid, tigecycline, and daptomycin.
Okay, and how do we treat community-acquired?
For community-acquired, we'd use clindamycin, Bactrim, doxycycline, and linezolid.
Okay, if these drugs fail, what are the current alternatives to treat MRSA?
The current alternatives would be they're using rifampin in combination with anti-staph agents. There's ciftraline, which is a 5th generation cephalosporin. There's Sinerzide, and there's telavancin.
Okay, thank you, Dr. Veltri. That was very informative. Now I'm going to bring it back to David and Drew back in the newsroom. Thank you.
Well, thank you, Kathleen. This is such a great information to have in this such an outbreak that we're having of MRSA. But how do you really prevent it, David?
Well, a lot of steps we can take are really simple. It's just a matter of staying clean, maintaining good hygiene, and you want to be comfortable with talking with your doctor and your local pharmacist. And that's pretty much it. And if you feel any symptoms like fever, and you don't feel too well, don't be afraid to just go over to see your pharmacist or doctor.
Well, there you have it. That's all we have from ID 709. We'll see you tomorrow evening, the same time.
Thanks for tuning in.